And welcome back to the show. The Black community has been hard hit, particularly by the COVID-19 pandemic, killing Black people at a substantially higher rate than any other population in America. Now, Choose Healthy Life is an initiative to fortify community infrastructure in order to address the COVID pandemic within the Black community, as well as strengthening local networks, increasing long-term community resilience, and saving lives. Joining me now to share and discuss more is the Associate Pastor of Canaan Baptist Church of Christ and social activist, Reverend Jacques Andre DeGraff, and then also the founder of Choose Healthy Life and National Black Leadership Commission on AIDS, Debra Fraser-Howze. And we thank you so much for being with us.
Thank you for having us.
And so I will start off with you, and we'll talk first, Debra, and talk a little bit about where we are right now. As we know, COVID-19 continues to have huge impact dealing with new variants and the like, but particularly when it comes to the issue of communities of color, more particularly African Americans, things seem to remain the same. So give me a little bit of your perspective and the work that you're doing.
Well, there's some good news. And then there's some not so good news. And the good news is that amongst our senior citizens, people that are anywhere between, I don't want to say seniors of 50, but 50 and up, they're getting vaccinated. They're getting vaccinated at good numbers. Those that are 25 to 35 is the group of people that we have to worry about most. We've got residual impact from COVID-19. Not only do we have the highest rates of death in the country from COVID-19, but we also now have 140,000 children who have lost a primary or secondary parent to COVID. So we're going to have orphan children with high death rates, coupled with the fact that the life expectancy for Black men has already decreased by 3 years. Which is a phenomenal number. These new variants that are coming into the country, and people were questioning whether or not we had them. Not to be questioned. As long as we remain a global community, and we will get every variant everybody else gets. So we should expect that. We should guard against it by getting vaccinated. Vaccinations is the that's available to us to actually protect us from the variants and this very terrible virus.
Yeah. Reverend DeGraff, I know one of the ways of getting the message out for vaccination and also awareness has been the church. So share with us a little bit about how you've been engaged and the church's response really to helping to deal with this pandemic.
Daren, thanks. It's a great question. The first thing you have to realize is that this pandemic has exposed, it's ripped the cover off of health disparities. They've existed before the pandemic. Our community always suffered maladies, health maladies at disproportionate rates. Why? Because the health system in America has failed us. And we've done in New York what we've always done, we turn to the church. And so Debra's vision has now permeated the country and the Black church. And in New York City, we have 20 churches that are involved in an exciting initiative. It's not just about a message on Sunday morning. It's about a financed, full-time person, a healthcare navigator, to help educate the community, to make sure we get vaccinated, but then to lead the work on an ongoing basis to end the health disparities. In effect, what we're saying is we're taking this valley moment and turning and pointing towards the mountaintop from whence cometh our help. We're looking to empower our communities by taking this crisis and flipping the script, if you will, by getting information, education, and resources. We've partnered with Quest Diagnostics, the United Way, and the federal government has recognized this Black church effort. And Daren, one important part is, a lot of us who are in the church, we think that my church is the most important church. And extend that out, it's my denomination is the most important denomination. But we have 20 churches across the city. It's interdenominational. We have AMEs and we have Presbyterians. We have Baptists and we've got Pentecostal. And so what we have done is created a network in New York. The national leaders are Reverend Al Sharpton and Reverend Calvin O. Butts. Debra is our Joan of Arc in this fight, but she's done it before with AIDS. And so when she made the call again, the response was tremendous across the country. In New York, we're in the Bronx, we're in Staten Island, we're in Far Rockaway, we're all over town. And it's an exciting venture because it's going to go beyond COVID. And this network is being built on sustainability, and that's where we are right now.
Reverend
Debra,
DeGraff, Daren, Reverend DeGraff is doing a fabulous job as the leader in New York City. We also have Choose Healthy Life, which is the name of the program. We also have a Choose Healthy Life in Atlanta, in Detroit, Michigan, in Washington, D.C., and in Newark, New Jersey. And we started out with 50 churches across those 5 cities. We are now in 120 churches in 13 states across the country.
awesome. And I know that the work is very necessary, very needed. But when you talk about our community, we know that the COVID-19 pandemic started off on a bad foot. We knew that there was bad messaging to come out of governmental agencies, and that really added to the distrust, a distrust that a lot of people really continued to feel while the pandemic was going forward. When the vaccination was first being introduced, we talked about healthcare disparities and that whole trust factor. So Debra, let me come back to you and talk a little bit about how do you deal with debunking a lot of the myths, the stereotypes, the things that that our people pretty much have hinged themselves on in terms of not getting vaccinated and not doing the necessary things health-wise that can better their outcomes.
Well, the disinformation is rampant whenever we have pandemics and epidemics like this. If we go back to AIDS, remember all of that disinformation. Black people didn't get AIDS. It was only a white gay man's disease. You get AIDS from going to the bathroom behind somebody or kissing or hugging or touching. And we had to work for decades to debunk all of that so we could get to the point that when the medications became available, we could tell our community, take the medication so you will not die. And look at what has happened with that. So we're in that same moment, that same ecclesiastic season where we have to be very, very clear. There's no reason why our people should not be skeptical and should not be afraid. I do want our people to be skeptical of any new thing that comes up, but I want them to get the facts. And the facts and the data prove a point. God also made medicine. He made the medicine for people with AIDS, and now he's got this vaccine out here for us so that we could stay alive. When you look at the data, no one that's vaccinated is dying from COVID. The vaccines don't keep you from getting COVID because you could still get breakthrough COVID, but it'll stop you from dying. It'll stop you from going into the hospital, being put on a ventilator, and not being able to breathe again. That's what's important about this vaccine. And what is happening is that there's a selfishness that's going on. We've always been the kind of people who care for community. And it's not just about you or me, but it's everybody that I'm in contact with. It's everybody that I live with. It's the children in my life that I have to be concerned about. That's why you go out and get vaccinated. So we have to debunk these myths. People think that if you take the vaccine, you'll become infertile. You won't be able to have babies. Somebody could put a magnet on your arm and the magnet will stay there because it's magnetized. They're tracking us. They're tracking me with my cell phone. I want them to give me something that's going to keep me alive. And this happens to be it for the moment. And we need to take it because we can't afford to lose another brother or sister to this or anything else.
Yeah, I'm 100% with you there. And, we have to increase the testing. We have to increase vaccinations. And, Reverend DeGraff, I know that is part of what the church's responsibility has been in responding to this, being vaccination sites, being vaccination clinics, and being an advocate to really talk about testing and awareness. From your perspective, how have churches, and I know you can't speak for all churches, I'm very well aware of that, but how have churches really been the one to, the response, if you will? What do you think the church's response in this pandemic has been like?
Well, the first thing is that we have to recognize that our experience in America causes us to pause about anything that's new. No matter what the ribbon looks like, we have to look at it differently than other communities because of our experience in America. Having said that, you've heard me, and I've said this on other occasions, we trust the science. It's the scientists that we've had problems with. The Tuskegee experiment is not the first time that we've been abused or misused, and it's not the last time. If you talk to Black women, our mortality rate in New York City is off the hook. And it's been off the hook, despite all the new science. And so our folk ask questions, and others make the mistake of not meeting people where they are. We have to respect the intelligence of a community that has survived in the belly of the beast for over 200 years. And so when we meet people where they are, then you present them with the fact. Because remember, the difference between now and when Debra was leading us against the fight against AIDS is this phenomena of social media. People have a title and they put something out there, and if you're not informed, Dr. So-and-so sounds the same as Professor So-and-so. But now the Black doctors have spoken. Now Black church is speaking, and so we've been able to move the needle. It's who do you trust? Used to be the name of a TV show, Daren, but it's the name of a phenomenon now in our community. In times of storm, we go to the rock, and the rock in our community is the Black church. And Debra's genius, if you will, has been being culturally competent and intelligent and speaking to people in ways they can hear. When people repeat a lot of what some of us now consider nonsense, it's their deeply held belief. You can't just over somebody. You have to listen. You have to then present them with facts. But too many of us have seen too many people die. We've said goodbye to grandma on FaceTime. And you have to remember something, Daren, that you started out with. When this started, people didn't want to get tested. They thought the test was a white supremacist plot. And so we've come a mighty long way. And remember now, 800,000 Americans have died. But at the same time, 50,000 Americans have been vaccinated because of Choose Healthy Life. 7 million Americans have gotten the word because of Choose Healthy Life. And so it's an idea whose time has come, and it's not just about COVID. We're not going to be reduced to COVID. It's an empowerment program for our community.
Yeah. Debra, I'll go back to you about this because I wonder, because there's a lot of people right now who have adopted this mindset. I really am trying to work with some people who've adopted this mindset because they said, listen, COVID has come. Without being vaccinated. They said, listen, I've done all right. They got a new variant. I wrote out, quote unquote, the worst. So no need for getting vaccinated. No need for me to take it another step further. But we know differently. And I know that part of what you're doing right now is addressing that. And, you've got the Community Solutions Action Plan. So I want you to share a little bit about that action plan and what you'd like to see occur through that.
Well, the action plan is actually a compilation of the clergy that form the Clergy Council, of which Reverend DeGraff is a part, under Reverend Butts and Reverend Sharpton. The clergy come together regularly to discuss what's needed, to look at what the churches are doing, to make recommendations, and to chart us on the right course. The other thing about the Community Action Plan, we work very closely with the United Way, and the United Way has created a template, I would say, for the churches to look at what activities are you going to do in your community that's going to reach a certain number of people with the right message, with the correct message. Who else do we need to bring in? Do we need to bring in the National Medical Association? Are there any doctors in your church that belong to the National Medical Association that can stand up on Sunday or be a part of your web service as you are using these video services for your regular Sunday services? Are there people there who can help us in the community? Who are the people down the block in the projects? Who knows how to get into the project and talk to the people and go into the community room and hold a meeting regularly in the projects to give out information? Can we do leafleting? Can we do other sort of knock on the door, contact direct. These are the people in the community and this action plan that takes the actions to the ground level and carries them out. And as Reverend DeGraff says, this is not just about COVID. We are meeting millions and millions of people all over the country that have all sorts of health issues. And one of the reasons why we died so quickly and at such great number was because we were so sick to begin with. So we have, people keep talking about, let's go back to normal. We have to get back to normal. And we always say at Choose Healthy Life, we're not going back to normal. We died in normal. We have to go back to the future where we do not die. We have to take care of ourselves so that we do not die. So that those things are part of the action plan. But it's not just COVID. That's going to be the plan moving forward. We have to address hypertension. We have to address diabetes. We have to address asthma in our communities where we have a lot of bronchial breathing problem. We have to address obesity. We have to address all those things that put us at greatest risk of death from this for this pandemic, because this is not the last pandemic. And for your friends who are telling you, oh, I made it through, you have not made it through yet. This is not over. These variants are coming at us left and right. We're going to be with COVID for a very long time. And then after COVID, it's going to be something else very similar to COVID. Get vaccinated. This is not a game. You can't play Russian roulette with your life. And that's what people are doing. That say, oh, I've made it so far. I had somebody tell me they made it the other day, and I got a call this morning that they have COVID. So you don't make it. You don't slip through like that. And there's no reason for you to play games with the people you live with and love and take care of. Take care of everybody by taking care of yourself.
Daren, there's one thing I think is important to add to what Debra has just told us, and that is this. When people say the preachers and the church, we want you to know that we didn't start out being scientific medical experts on this. We had to bone up. We had to meet with Dr. Fauci. We had to meet with the First Lady. We had to meet with the leaders of CDC repeatedly. It wasn't a one-off seminar or a workshop. We've been doing this over the course. So the passion that we speak from is informed passion. And the equation to expand Deborah's response is, it's not enough that you wrote out the first wave. Okay, the question also needs to be, would you threaten your grandmother? Do you love your nieces and nephews? Would you play roulette with their lives? Because you can be perfectly asymptomatic and pass it on to somebody that you love. And then, I'm sorry. I'm sorry doesn't cure a lot of things. It certainly doesn't cure COVID.
Yeah, it's a lot on the table. It's a lot on the table. So, Debra, before we get out of here, I want to have the opportunity for people who want to get connected. How do they go about getting connected with you?
They should go to our website, www.choosehealthylife.org. Choosehealthylife.org, make it one word, .org.
All right. Reverend DeGraff, for pastors, ministers, faith leaders who want to get connected, what do they do?
Go to that same website and get ready. We'll be reaching back out to them. And remember that this is a fight where we come with resources. We come ready to rumble. And that's what I referred to when I talked about Quest and United Way and HRSA. We've got dollars, we've got people, and we've got God.
All right. Well, thank you so much, Reverend DeGraff, and thank you so much for joining us, Debra, for being with us and the work that you're doing and spreading the word and also keeping the good fight going. Thanks much.
God bless you.
God bless you.